Good morning. Welcome to part 1 of nursing practice questions and answers about risk conditions related to pregnancy. Now let's start with the first question. The home care nurse visits a pregnant client who has a diagnosis of preeclampsia. Which assessment finding indicates a worsening of the preeclampsia and the need to notify the primary healthcare provider? So these are the options. Option A, urinary output has increased. Option B, dependent edema has resolved. Option C, blood pressure reading is at the prenatal baseline. Option D, the client complains of a headache and blood vision. Now for this question, the correct answer is option D. The client complains of a headache and blood vision. Now, what is preeclampsia? Is a type of hypertensive disorder that usually occurs after 20 weeks of pregnancy. Having preeclampsia once increases the risk of having it again in a future pregnancy. Now let's move to the rationale. If a mother with preeclampsia complains of headache and blood vision, the primary health care provider needs to be notified because these are signs of a worsening preeclampsia. Options A, B, and C are normal findings. Now let's move to the second question. The nurse implements a teaching plan for a pregnant client who is newly diagnosed with gestational diabetes mellitus. Which statement made by the client indicates a need for further teaching? So these are the options. Option A, I need to stay on the diabetic diet. Option B, I need to perform glucose monitoring at home. Option C, I need to avoid exercise because of the negative effects on insulin production. Option D, I need to be aware of any infections and report signs of infection immediately to my obstetrician. The correct answer for this question is option C. I need to avoid exercise because of the negative effects on insulin production. Now, what is gestational diabetes mellitus? Is defined as glucose intolerance of variable degree with onset or first recognition during pregnancy. Risk factors for gestational diabetes mellitus include the following. 1. Previous history of gestational diabetes. Maternal age over 35 years. 3. Being overweight or obese. Now let's go to our rationale. Exercise is safe for a client with gestational diabetes mellitus and is helpful in lowering the blood glucose level. Now, in my presentation, my reference book have used Saunders Comprehensive Review for the NCLEX RN Examination 9th edition.